Hello friends, I am Dr. Tushar Rani and today I am going to discuss with you on a very important topic which is diabetes. So what is diabetes? Diabetes is an autoimmune progressive disease in which the beta cells of the pancreas are destroyed by the body's immune system and therefore the amount of insulin produced is less. It is a chronic medical condition characterized by elevated levels of blood sugar levels. This occurs due to body's inability to produce enough insulin or effectively use the insulin it does produce. Insulin is a hormone that helps regulate blood sugar levels. There are different types of diabetes, type 1 diabetes and type 2 diabetes mostly. Coming to type 1 diabetes, this results from the immune system mistakenly attacking and destroying insulin producing beta cells in the pancreas. People with type 1 diabetes require insulin injections or an insulin pump for survival. Coming to type 2 diabetes, this occurs when the body either doesn't produce enough insulin or can't use it effectively. It is often associated with lifestyle factors such as diet and physical activity. Management involves lifestyle changes, oral medications, and sometimes insulin. Additionally, there is gestational diabetes that occurs during pregnancy. Each type requires different approaches to management. You might have heard that insulin secretion, which controls the blood sugar levels in our body, is being secreted by the pancreas. So where are the pancreas located? Pancreas is an organ which is located next to the stomach, which secretes insulin and which further controls the blood sugar level in our body. So in type 1 diabetes, almost all the beta cells of the pancreas are destroyed, leading to no or very little insulin secretion. Whereas in type 2 diabetes, mild to moderate destruction of beta cells happens, leading to decreased secretion of insulin. And since diabetes is a progressive disease, progressively the number of beta cells are being destroyed and the amount of insulin being secreted by the beta cells keeps on going down. Now let us see what are the symptoms of diabetes. Diabetes means hyperglycemia. That means increase in the blood sugar levels. So when there is increase in the blood sugar levels, the symptoms that one commonly gets is 1. Dry mouth, secondly, increased thirst, third, weakness, headache, sometimes blurred vision and frequency of urination. Whereas in hypoglycemia means decrease in the blood sugar levels. So in hypoglycemia, what are the symptoms that one could see? 1. Sleepiness. Second, excessive sweating, pallor, lack of coordination and concentration, irritability, hunger. These are the symptoms that one would see if the patient's blood sugar level goes down. Now we'll see how our body is able to regulate the blood sugar levels. If there is increase in the blood sugar levels, there is increased secretion of insulin from the pancreas, which further leads to conversion of the sugar in the blood to glycogen, and this glycogen is stored in the liver, thereby reduction in the blood sugar levels. Now in case there is decrease in the blood sugar levels, what happens is there is secretion of glucagon from the pancreas. This glucagon converts glycogen stores from the liver to glucose. This glucose thereby comes in our blood system and there is increase in the blood sugar levels. Now we'll see the blood sugar levels in normal patients and patients who are having diabetes. A fasting blood sugar level of 70 to 100 is a normal blood sugar level in a normal patient. If the blood sugar level is between 101 and 125, the patient is said to have prediabetes. If the fasting blood sugar level is over and above 126 milligrams per deciliter, the patient is said to have diabetes. Now, when do you call that the patient is having diabetes? So, there are specific criteria to diagnose the patient to have diabetes. So, let us see. The first is patient is having symptoms of diabetes, which I mentioned before, plus the random blood sugar of the patient is more than or equal to 200 milligrams per deciliter. Second, the fasting blood sugar of the patient is more than or equal to 126 milligrams per deciliter. Third, the HbA1c of this patient is more than or equal to 6.5 milligrams per deciliter. Fourth, the 2-hour plasma sugar level is more than or equal to 200 milligrams per deciliter during an oral glucose tolerance test. These are the 4 criteria to diagnose the patient to have diabetes. There can be various complications in diabetes. Let us see. Cardiovascular complications, which is heart disease, hypertension, neuropathy. Neuropathy means nerve damage. The types of neuropathy is peripheral neuropathy, autonomic neuropathy. Third one is nephropathy. Nephropathy means kidney disease. Diabetic nephropathy, because of high blood sugar levels, it can damage the kidneys, leading to chronic kidney disease. Eye complications. Eye complications include diabetic retinopathy, cataracts and glaucoma. Skin complications and infections. Foot complications, ulcers and infections can happen. Mental health issues like depression, cognitive decline can happen in diabetes. Gastrointestinal issues like gastroparesis. Nerve damage can affect the stomach, causing delayed emptying and digestive problems. Dental complications, gum diseases. Reproductive issues, erectile dysfunction, especially in men. Pregnancy complications. Women with diabetes may face challenges during pregnancy, affecting both mother and baby. So these are some of the examples of complications which happen in diabetes when the blood sugar levels is not controlled. Now, what are the risk factors of diabetes? First is weight. The more fatty tissue you have, the more resistant your cells become to insulin. So being overweight is a risk factor for you to have diabetes. Second, inactivity. The less active you are, the greater your risk of having diabetes. Physical activity helps you control your body weight, uses up the sugar in your blood, and makes your cells more sensitive to insulin. Third, family history. Your risk increases if a parent or sibling has type 2 diabetes. Race or ethnicity also plays an important part in you having diabetes. Next, age. Your risk increases as you get older. This may be because you tend to exercise less, lose muscle mass, and gain weight as you age. But type 2 diabetes is also increasing among children, adolescents, and younger adults. Gestational diabetes. If you developed gestational diabetes when you were pregnant, your risk of developing prediabetes and type 2 diabetes increases. If you gave birth to a baby weighing more than 9 pounds, 4 kilograms, you are also at risk of type 2 diabetes. Polycystic ovarian syndrome. For women having polycystic ovarian syndrome, a common condition characterized by irregular menstrual periods, excessive hair growth, and obesity, it increases the risk of diabetes. High blood pressure. Having blood pressure more than 140 by 90 is linked to an increased risk of type 2 diabetes. Abnormal cholesterol and triglyceride levels. If you have low levels of HDL or good cholesterol, your risk of type 2 diabetes is higher. People with higher levels of triglycerides or LDL levels are also at a higher risk of having type 2 diabetes. Smoking and diabetes are a concerning combination due to the compounding health risks they pose. Here are key points regarding the relationship between smoking and diabetes. Number 1. Cardiovascular risks. Both smoking and diabetes independently increase the risk of cardiovascular diseases. When combined, they synergistically elevate the likelihood of heart attacks, strokes, and other heart-related issues. Number 2. Insulin resistance. Smoking has been associated with insulin resistance, making it more challenging for the body to utilize insulin effectively. This can contribute to difficulties in managing blood sugar levels for individuals with diabetes. Worsened nerve damage. Diabetes can lead to neuropathy, and smoking may exacerbate this condition. The combined effects can increase the risk and severity of peripheral neuropathy. Impact on blood vessels. Smoking damages blood vessels and can accelerate atherosclerosis, a condition where arteries become narrowed and hardened. This is particularly concerning for people with diabetes as they already have an increased risk for vascular complications. Reduced blood flow. Smoking further impairs blood circulation, which can contribute to complications like peripheral artery disease. Individuals with diabetes may already experience challenges related to poor blood flow. Impaired wound healing. Smoking hampers the body's abilities to heal wounds. Considering that diabetes can affect wound healing, smoking can exacerbate this issue, leading to an increased risk of infections and other complications. Increased inflammation. Both smoking and diabetes are associated with inflammation. Chronic inflammation is a factor in the development and progression of various diseases, including diabetes complications. Now, what are the benefits of quitting smoking? Quitting smoking has immediate and long-term health benefits, including a reduction in cardiovascular risk, improved lung function, and enhanced overall well-being. It can also positively impact diabetes management. For individuals with diabetes who smoke, quitting is a crucial step in managing and reducing the risks associated with both conditions. So to summarize, diabetes is a chronic condition marked by high blood sugar levels. Two main types exist: type 1 and type 2 diabetes. Symptoms include increased thirst, frequent urination, and fatigue. Complications include cardiovascular issues, neuropathy, kidney disease. Risk factors include family history, age, obesity. Management involves blood sugar monitoring, medications, a healthy lifestyle, and regular medical care. Thanks a lot for a patient hearing. Thank you.